Cancer of the cervix occurs in the cells of the cervix, which is at the lower part of the uterus connected to the vagina. The abnormal growth of the cells has the ability to invade or spread to other parts of the body. Gynecologist and director of the General Hospital, Dr. Coral McIntosh, explains that the cancer is mainly caused by various strains of the HPV virus, a sexually transmitted infection.
So in every woman, after they reach the period, the cells on the cervix are changing normally. They change from one cell type to another. And that's a normal occurrence that occurs up until they reach menopause, when they stop having their periods or when they stop putting out estrogen. But what happens when the cells, as they're changing, it's a normal process, but if something happens, which would be an introduction of the human papilloma virus into the cell, it transforms that cell and it can make the cell abnormal. So that cell then becomes an abnormal cell, and if you don't do anything to treat it or detect it or to stop it, after 10 to 15 years, it keeps getting more and more abnormal and spreading and can become cervical cancer.
Some of the risk factors for cervical cancer include multiple sex partners, other STIs, and smoking. Dr. McIntosh says in the early stage of cervical cancer, there is no signs or symptoms. But when the cancer is at its advanced stage, women experience bleeding after intercourse, pelvic pain, among other symptoms.
So you can have a smelly discharge or a type of a discharge that says there's an infection with overgrowth of bacteria. So that can be another sign. Then the more advanced signs, if it's growing further and further out, the cervix sits there, the bladder is on top, that's where you urinate from, and below is the rectum. It can start to grow and then grow outside of its boundaries into the bladder and into the rectum. If it does, it makes a hole into it, and you can have urine coming into the cervix or going down into the vagina. And so as you start to see or smell a foul discharge, or you find that this smells like urine and I'm not trying to urinate and it looks like it's coming out of my vagina, those are other signs.
The gynecologist says early detection and routine pap smear tests are extremely important.
So 70 to 80% of cervical cancers have that HPV in them. So that means, but it doesn't mean that it happens. If you get HPV today, you're going to have cancer tomorrow. It's about 10 to 15 years. So that means, can we stop that process where it's starting to make the cells abnormal? If we stop it, we stop the cervical cancer. So how do we do that? We first have to detect it. And that's where we started. The initial point was with the pap smear, where you went in and the doctor or the nurse would take a little bit of cells off of the cervix and check, did the cells become abnormal.
Dr. McIntosh is calling on all women to be screened as soon as possible. For GBN News, I am Rina Pear reporting.